Well, good morning, everyone. Welcome to the fourth webinar in our 8-part webinar series, Communication Strategies for Community Outreach and Education. Today, we'll be learning about strategies to customize messages based on generational and cultural backgrounds. My name is Kim Norden, and I'm the Program Coordinator for the Delta Region Community Health Systems Development Program, or Delta for short. If you haven't already done so, please add your name, title, and organization to the chat box, which you will find on the bottom of your Zoom screen. I'll be sending the slides and recording of today's webinar to you all next week. If you have any questions or comments today, feel free to use the chat box at any time. We'll save some time at the end of this webinar for our speakers to answer any questions that come in through the chat box. To avoid background noise and feedback, please remain muted when you're not speaking. Now, let me introduce you to our speakers, Dr. Mia Farrell, Assistant Dean and Director for Diversity at the University of Kentucky, and Mr. Mike Milligan, President of Legato. Dr. Farrell, a native of Louisville, Kentucky, graduated from the University of Kentucky in 2011 with a Bachelor of Science in Agricultural Economics. In 2014, she received her Master of Science in Human Development Leadership with a concentration in college student personnel from Murray State University, and is currently working toward her education doctorate degree. Dr. Farrell currently serves as the Director of Diversity for the University of Kentucky College of Agriculture, Food, and Environment, and the Human Resources Specialist for Cooperative Extension Service. Mike Milligan is a healthcare communication strategist, educator, and media trainer. Mike has directed strategic planning efforts for a variety of rural and other healthcare organizations, serving as counsel for CEOs and other executive team members. Mike is a highly requested speaker for healthcare national conferences, and he is a regular contributor to industry publications and blogs. Before founding Legato, Mike previously served in a communication leadership role for Previa Health in Green Bay, Wisconsin, and Director of Public Relations and Strategic Communications with Aurora Health in Milwaukee, Wisconsin. Thanks for joining us today, everyone. Now I'll turn things over to Dr. Farrell and Mr. Milligan.
Good morning, everybody. Thanks again for joining us this morning. This is we're really excited about today's presentation, to be able to do a joint presentation with Dr. Farrell, and again, we're privileged to be part of the Delta program and to have this opportunity with you. What we're going to be talking about today, as we've kind of discussed in the introduction here, is cultural and generational differences and how they affect our communication, our style, our approaches toward different people, different cultures and generations, regardless of age or our cultural background. We need to be aware and learn from one another. And as we've said here, I mean, how enlightening that is to be able to recognize differences in people and how we perceive different information, how we translate different information. So before I hand it over to Dr. Farrell, just as a brief agenda here, we're going to cover a lot of things in a short period of time. So we're going to be talking about, in general, what is culture. We're going to be talking about, understanding what cultural competence is. We're going to learn about and 6 tips on engaging communities. And then with that background, we're also going to talk about how generations, we kind of are, in many ways, we kind of look at them as a culture themselves in terms of how maybe we should communicate differently based on different cultural backgrounds of people, and not only that, but different generations, and how those different generations form and have different ways of which they'd like to receive communication. So with that, we're going to start out with sort of a preliminary question here, and then Dr. Farrell will take it from there. So our first question we'd like to ask the group is, how confident are you currently in recognizing the various cultural and generational differences in order to better communicate while building trust and understanding? We'll just take a moment and have you answer one of the answers below.
All right, the answers are still coming in. We've got about 84% who have voted.
Okay.
I'm going to share those results with you now.
All right, so Dr. Farrell, you can see that generally speaking, we have a medium confidence, so that's good, right?
That's
maybe we
great.
could
By the end, I'm hoping that we see higher.
Exactly. All right.
This is Geneva Bryant with Scott Memorial Health Systems. I taught school for years in a rural area in middle school. So I dealt with a lot of parents, and because of that, I really have high confidence on communicating with the people in our area.
Excellent.
Awesome.
That's good to hear. Very good. Okay, Dr. Farrell, why don't you go ahead and take it away?
All right. Well, thank you so much. And so I am logged on into two devices. And so just want to make sure, can you all hear me?
Yes, I can.
Perfect. So we're going to start this morning and talk about what is culture. And so culture involves shared customs, values, social rules of behavior, rituals and traditions, and perceptions of human nature and natural events. Elements of culture are learned from others and may be passed down from generation to generation. And so today we are going to talk about how generations and culture truly play into communication. And so I'm hoping that by the end of today, you can see that you may identify, or someone that you work with or in the community may identify with one or more cultures. And then from that, what does communication look like? And so we are going to move on to the next slide. So here is a slide that shows examples of different cultural groups. And so this list is not inclusive of all, but in order for us to be able to share exactly what culture looks like, we wanted to give some examples. So I'm not going to read all of them, but definitely you will receive this presentation at the end. And so you will be able to see the list in its entirety. So geography, culture, gender, spirituality, parental status, so on and so forth. And so you may identify with one or more of these examples. And then also looking at your community. What do the demographics look like in your community? What does the makeup of your employee base look like? And so it's important for us to be able to identify what those different cultural groups are in order to meet the needs of our community or even our employees. Next slide. So when we talk about considering the potential cultural needs, we have to look at cultural needs from an equity lens. And so when we talk about looking at folks from an equity lens, we have to make sure that we are knowledgeable and understand what diverse audience look like. And then also, how do we meet the needs of those persons from those different identities? And so remember that we do not live in a monolithic society. So I could very well come from a rural area. And because I come from a rural area, that may not be the way that people perceive me or the way that I act based on that rural area. And so what I'm saying, just because a person identifies with a specific identifier or characteristic, that person is not that spokesperson for all groups. We all have different lived experiences. We all come from different backgrounds and have different upbringings. And so when we talk about this monolithic society, yes, we can share our experiences, and we have to be able to understand it's not everyone's lived experience. And so we can go to the next slide. So to bring it full circle, I wanted to share a few examples of culture in the healthcare system. And so the first example here is I once had a patient from Morocco who had been hospitalized for pneumonia. When I arrived at the unit, several nurses, nursing assistants, and the ward clerk were engaged in a loud argument with a group of Moroccan friends and family members. The staff were trying to escort the visitors out of the patient's room. So in Morocco, they wouldn't consider leaving a sick relative alone in a hospital room. The notion of visiting hours, which is so normal for us, was completely unusual for them. And now we know we're in COVID, so definitely things are different. But pre-COVID, this is a true example of cultural differences and norms. The second example is when I practiced in New York. Orthodox and Hasidic Jewish traditions help shape our policies and procedures. The hospital had a Sabbath elevator, so no one had to do the work of running the elevator on the holy day. And healthcare professionals and patients were not supposed to make physical contact across gender lines. We also observe plenty of dietary customs from various cultures: kosher, halal, and vegetarian menus. Seaweed soup being served to Korean women after giving birth, and attention paid to the hot and cold properties assigned to various foods in traditional Chinese healthcare. And for the third example, one of my most memorable patients was Grace, an African American Jehovah's Witness. Grace was in her late 70s and very sick. One of her heart valves wasn't working, and she needed major cardiac surgery to replace it. Grace had also had bleeding tendencies and would require transfusions during the operation. Jehovah Witness usually decline transfusion of whole body, not due to perceived risk, but it is based on interpretations of biblical text. So again, the importance of cultural awareness, because you are serving those who are coming to your facilities. And so with that, can you all hear me?
Yes, once in a while we're getting, I think your connection may be a little slow. It's kind of cutting in and out a little, but right now,
Okay.
yep, now it's back, it looks like. Yep.
Yeah. So, once in a while we're getting, I think your connection may be a little slow. It's kind of.
Okay, I'm going to from my phone.
Okay,
Can you hear me from my phone?
we can hear you. Yep, we can hear
Okay,
you.
can you
Yeah.
see me?
And we can see you. If it helps with your broadband to turn off your camera, you can certainly go that route as well, as long as we can hear you.
Okay, perfect. All right, we can go to the next slide.
Okay, so we're on the slide now that says, what would you do? Or we're going to have the discussion. Can you see the screen now, Dr. Farrell?
It's popping back.
Okay.
Sorry
I can,
about this.
no, that's okay. I can read it for you if you'd like while we were kind of getting that set up too.
Oh, I think you're on mute now.
You got to turn your mute. There you go.
Technology. Can you hear me now?
We can hear you.
All
Yep,
right.
Yep.
All right. So all right, perfect. So we are going to do a short live discussion. And so with this live discussion, if you all do not mind to type in the chat box if you wish to do so. So a Native American patient with diabetes and amputation refuses treatment. She believes that entering the hospital will kill her and opts for traditional therapies. Her family physician desperately wants to work with the patient to manage her diabetes better. And so, with this being taken into perspective, what are your thoughts? What are your comments or ideas based on this scenario here?
And Kim, I think we're also going to open up the lines if people wanted to share and not chat too, right? I believe.
Yeah, absolutely. You can unmute yourself and share just with your voice if you don't want to type into the chat box.
Thank you. And remember, we are on a journey. And so do not feel like you have to have all of the answers. But we do want you to be engaged in our conversation as we go through this journey together.
This is Geneva Bryant with Scott Memorial Health Systems. I have a background in nursing as well as teaching, and a home visit or a telephone call, or I would really try a home visit with this patient, especially since I'm in a rural area, explaining what actually is going to happen in the hospital and how that's true in the past. And I remember my grandparents felt that way, that you went to the hospital to die, but now the hospital can help you get better and teach you how to take care of yourself so that you won't die.
Thank you so much for sharing. And you bring up very valid points. And so having that conversation and really taking that patient step by step on exactly what is going to be taking place and being empathetic, because it's very important to show empathy and compassion and to be able to break it down to where they understand and where they feel comfortable. So I appreciate you sharing. One more thought before we move on. Anyone want to share? All right. All right, we have some in the chat box.
Oh, great.
Communicate to the patient with compassion and concern with proper procedure. Absolutely. Thank you, Deborah. All right. So we're going to move on to the next slide. So what is culture? Cultural competence is not about being politically correct. Rather, it is about customizing your engagement strategy to the needs of each audience. And so I know a lot of times we talk about being politically correct or not wanting to make things political, but we don't make things political until we make things political, right? And so we have to understand that we have to meet the needs of each individual person. And at the end of the day, it may not affect you directly, but it can affect you indirectly. And so making sure that we're culturally competent is very important.
Dr. Farrell, Dr. Farrell, I just want to make a comment on this. I just think that this simple statement says so much, because I just believe this is so true, because you have to say, well, why are we thinking about cultural competence? And it's just, as you've said here, I think we're sometimes we hear so much in society of, well, we have to be politically correct. And it's like, well, yes, you do, but at times, but that isn't why you're focusing on this. It's because you're being considerate of different cultures and different backgrounds. It's not just because you have to, it's because you should do this. So
absolutely. Thank you so much, Mike.
Yep, you're welcome.
So the importance of cultural competency. So the healthcare workers need to be aware of and sensitive to culturally diversity, life situations, and other various factors that shape a person's identity. The first step is an open, non-judgmental attitude. And so we talk about unconscious bias, right? And so we all have unconscious biases, but the goal is to mitigate those, right? And so with that, we have to come in from a non-judgmental standpoint. It helps to reduce those stereotypes. And then culturally competent care depends on resolving systemic and individual cultural differences that can create conflicts and misunderstandings. We also have to be very aware of our body language, and that is verbal and nonverbal. And we can truly pick up on those nonverbal cues very quickly. So we have to be mindful of those. And then some other factors to consider would be gender, wealth, or social status, presence of disability, or I like to say different abilities, sexual orientation, and then also gender identity. Next slide, please. So how do we improve cultural competence? I'm glad that you asked. So first, we have to establish clear communication. So communication is very important. Be aware of nonverbal cues without jumping to conclusions. Ask openly about potentially relevant traditions and customs. And so it takes time to really learn about the different traditions and customs, but we can do research. And then also, we can engage with people from different backgrounds to learn about their traditions and customs. Use normalizing statements and then examine your own bias. Next slide, please. So, communication. So, these studies highlight the need to prepare healthcare professionals with communication skills and techniques that optimize opportunities for patient engagement. And so, studies have shown that physicians have inaccurate perceptions of their patients' health beliefs, assuming that their patients' beliefs are more aligned with their own than is actually the case. This misperception improves when patients are able to participate actively in the consultation. Next slide. So studies tend to interrupt patients within 15 seconds of their beginning to speak at the outset of a visit. So while uninterrupted, patients tend to conclude their remarks in under 1 minute. And so again, communication is very important. It's very important. Although we may be in a position, we also have to realize that we have to build that relationship. And we have to be able to allow our patients, allow our community, allow folks' voice to be heard, and then allow our voices to be heard. Because if we come in and we just spat out everything, then we could lose a relationship or lose that trust from a potential patient or even from those in the community. And so it's very important for us to understand how important communication is. Next slide.
I could just make a comment on this too. I just find this statistic amazing, probably not surprising, but amazing. And I wonder too, do you think that the advent of electronic medical records, although, you know, obviously a positive thing, but has that taken away sometimes the engagement that providers can have because they're too concerned about, you know, monitoring what's on their computer as compared to having a direct communication with a patient?
Absolutely, Mike. Absolutely.
Yeah.
Softball. Nothing better than being able to talk one-on-one, right?
Yeah. Yeah.
All right. So for the next slide here, I'm going to talk a little bit about effective communication. And so I'm going to use the acronym LEARN. And so for L, listen to the patient's perception of the problem. E, explain your perception of the problem. A, acknowledge and discuss differences and similarities. R, recommend treatment. And then N, negotiate treatment. So again, it is a two-way street of communication, and it is truly being able to learn from the patient and the patient learning from you. Next slide. So the big word here that is most important to me is being intentional with effective communication. And so what does that look like? Dialect, words, and even regional accents have different meanings within one language. And so I'll say for me, when I travel different places, they say, "You're not from here, are you? You sound like you're from Kentucky." And so I know that I have a slight accent being from and living in Kentucky. Using bilingual staff is not always sufficient, as the same language does not equal the same culture. Example, different socioeconomic backgrounds. Next slide, please. So, generations are cultures too, right, Mike?
That's correct. That's correct.
So when it comes to managing intergenerational differences, we can draw many parallels to navigating cultural differences. So just as you would with a culture, do your research, understand the key drivers and events that have molded the group's behaviors. So I'm going to turn it over to Mike to delve more into the presentation on communication and generations.
Sounds good. Thank you, Dr. Farrell. And by the way, please, we love your insights. So we want this to be an open dialogue. So as I'm going through things here as well, if you have anything that you want to emphasize or expand upon, we really would welcome that. Okay. So, just building off of that a little bit, when we talk about communicating and looking at generations as kind of part of that cultural definition, it's really understanding those differences and that they do behave differently. And again, there's, we are kind of putting people a little bit into a stereotype, but it's for the purpose of a broader good. There's always, of course, exceptions to every rule. But in general, each generation, as we've said here, expects a certain type of content, and it's different among generations in terms of how they generally receive information. So just to go through a little bit, you've certainly heard the different categories that we have, and our emphasis here isn't necessarily to focus on that, but really more in lines of the communication preferences. So you have, first of all, what's considered a traditionalist, and those who are born between 28 and 45. And the general message here is that they want to be directed. They may be a little bit more traditional, and they listen to their physicians, generally speaking. They follow those directions explicitly. The doctor told me this, okay? And so their healthcare decisions, the healthcare decisions are made by, advice from the healthcare professionals and overall quality of service. Then you have the baby boomers, born between 1946 and 1964. Again, you're going to see they want to be engaged already, and we're going to notice that I'm sure a lot of this is not new to you, but as we get further along the generational timeline, you'll see even more of this. But they want to be engaged. They are learning, and they're searching for health information online, and they are probably more influenced. Even though they are online, they're more influenced than other markets in terms of what we would consider traditional advertising, which might be, television and newspaper and things like that. They're still influenced by digital, maybe not as much as other areas. Having said that, they still are making decisions by online ratings and overall reputation of an organization. So you can see already they're becoming engaged, and they're making decisions based on that. Generation X, kind of went from that engagement to actually wanting to feel connected. So again, as you kind of think about some of the things that Dr. Farrell said in terms of, this is why we kind of define a generation in a way as a culture, is that, as you're being mindful of maybe different backgrounds that people have in terms of their upbringing, those types of things, it's also kind of their psyche in terms of the time period in which they grew up and how that influences their decisions as well. And so anyway, this categories, they're responsible already now for, and this is the key here, is impact their parents and their children. So that's the huge transition here. So a lot of things that are coming to mind for them. And so and those healthcare decisions now, because of that, are certainly being made regarding convenience. And they're selecting from multiple options potentially as well, all depending on maybe who they're providing who they're selecting care for, if it's for their children or their parents or what have you. So lots of other factors that are coming into play. And then millennials, born between 81 and 97, they want it now. They want information now. They prefer kind of more passive forms of communication. don't always maybe want to pick up the phone. They want, they want it digitally. Their healthcare decisions are made more peer driven, and also then certainly being made more on cost. So as we're very well aware, we have, more high deductible plans, those types of things. A lot of people being more conscious of, in terms of out-of-pocket costs, and we have a much more cognizant population in terms of how much their care is costing. Generation X, again, 97 to 2012, they are influencers. And this is, this is where we have to continue to change evolve our thinking. They expect a personalized experience. Having said that, they say at least that they actively avoid ads, but they don't necessarily, but they say they do. Healthcare decisions are made, again, by digital offerings, but then they're also asking their parents and they're asking their friends as well. So, obviously similarities between some of the generations, but you can see sort of the evolution. So what does that mean for us? So as we look at, last week's session, all the things that we learned, right, about achieving objectives within the plan, that's where when we kind of think about the goals that we're going to make and things like that, as we talked about, some of those might be generational, and we look at how we're going to make those things specific in terms of different generations, and really understanding those wants and needs as we get into our messaging and those types of things as well. So what I'm going to do here is I'm going to now kind of break this into, we kind of have different categories that we'll look at in terms of those multi-generations, and how these different audiences between maybe your internal audience, your hospital workforce, existing patients and potential patients, and how this kind of background might influence the way that you communicate with these different groups. So, we kind of listed, 5 groups, but generally speaking, in terms of what we're seeing in the workforce right now, and this of course will change, but we're seeing generally about 4 of those generations that are together in the workforce. So a couple key statistics here to remember is that millennials, that group is projected to be 50% of our workforce. So by 2030, that the millennials will outnumber boomers by 22 million people. So baby boomers, as we know, will be retiring. They are retiring. And diversity is likely to result in differences in attitude and aptitude. So again, as we think about what we look in terms of that cultural competence, it's again, it's the psyche, it's the thinking of how different generations, and sometimes when we think of, oftentimes I think it's when we think of diversity or we think of cultural diversity, we often think of it in terms of many of the factors that Dr. Farrell mentioned in terms of, gender or, cultural background, things like that, but we don't necessarily always think about it in terms of just generations themselves and how we have to be sensitive to the different ways that different people communicate and behave. So again, if not managed effectively, generational differences can lead to frustration, conflict, even poor patient care. I'm sure you've seen some of that even in the workplace. Those of you who are clinical providers, and you just see maybe different expectations that different people might have. So to kind of go a little, go ahead. Was there a question?
And I was going to give an example.
Yes.
And
please.
so, prior to COVID, how many, and I want you to be honest, it's okay. Mm-hmm. How many supervisors resisted their employees from working at home? And I know here we had a lot of supervisors who were like, no, I want to see you in the office, in your chair from 9 to 5. Take your breaks, take your lunch, but I want to see you. And now that we're in COVID, we are seeing that our employees are progressing. They are doing an amazing job working from home and we're really seeing the productivity increase. And so as we look at different generations, again, we have to get back to what works for you, what works for your generation in order to make you productive in this setting. And so it's very important for us to be able to manage multiple generations and also seeing how and what we need to do to continue to support them in their respective roles.
That's awesome. Yeah, thank you. We'd love to hear from anybody who wants to chime in on this conversation. So please, if you'd like to just share anything, just unmute and share. I'd love to kind of hear an answer to Dr. Farrell's question more in terms of, generally, has your thought process changed with maybe how people were working from home now versus what they were before? Has that changed, your thought process?
This is Geneva Bryant. Once again, I have a problem with silence, so I usually speak up. But yes, I find that now that it's necessary to work from home, that we're able to do it. Now that we're learning new technology such as Zoom and webinars, and we can get all this information and we can interact with people, I can see that working from home is very productive. Whereas I can't speak, now it is on this level, but I still kind of worry about school teaching and the children, the interaction with the children. But on this level, I think it's working well.
Excellent, thank you. Okay, good. I'll kind of keep going here, but please, I love the dialogue. This is what we want. So that's fantastic. So a couple of things to kind of keep in mind as we're looking at and being aware of these different backgrounds. So when we look first at this audience that I'm referring to, which is our workforce, and we've had some conversations about that already, which is great. You look at some down the left here column here, and just some different ways in which, and there's many other types of things, but if you kind of go back and think about what I was saying in terms of, and we'll provide you these slides again, so it'll kind of give you some background on this, but as you look at across the top and you see those different, the traditional, the baby boomers, the Gen X and the millennials, when you look down the column on the left, you can see, how in, different programs might be more receptive, that different audiences might be more receptive of some things than over the other. You can kind of just see the differences in terms of the face-to-face communication and things like that. So, I mean, as an example, like even, within our company, we have a good share of millennials, and but other generations as well. And it's always even an interesting dialogue in our organization in terms of being cognizant that even though you may prefer a certain way of communication, your audience may not. That to me, that is just so critical, whether or not it's again thinking, okay, yeah, it's convenient for me, but how do the people that I'm communicating to, what is their preferred way? So anyway, so then, one of the things that I just want to share as well, that in terms of communication, and this is getting into some education aspects as well, but is something called reverse mentoring. And why I mention it here is because I think it does play off of what I was just talking about a little bit, which is to put yourselves in the shoes of the person to whom you're communicating. But so, oftentimes, what we're talking about here is that just because maybe you have more experience or because you're older, of course, doesn't mean that you can't learn from people with less experience or that are younger, because just as we've been kind of talking about through this whole session, we all come from different experiences and we all come from different backgrounds. And I mean, I can tell you for sure, I absolutely learn from people who are younger from me every day. And it's like anything, we know the tenets of basic communication, which is listening and those types of things as well. So, but I just share that in the context of whatever audience that we're communicating to, if it's our fellow employees or if it's our patients or prospective patients. In terms of really building that cultural competence is also, maybe moving away from our paradigm that it's the older folks or the more experienced folks are always the mentors. The mentors can be at any background. So anyway, creating that culture that fosters that better communication and collaboration, and really just encouraging that collaboration, group training, those types of things as well. And overall, that's just building trust and transparency with any group. So, as we've talked about here, when members of each generation understand their differences, they come together as a team. So that comes into place certainly as we talk about recruitment in our hospital workforce, different ways in which we might communicate with prospective employees. And again, even in our communications, when we're aware of that, we can target different generations in our methods and our messaging, those types of things as well. For instance, might include more presence in terms of your digital presence for some than others. Just providing you just some examples to kind of just get your thoughts going a little bit. So, and then one of our audiences that we talk about as well is obviously our patients. And so this focus, what we're talking about here, is along the lines of kind of more of the communication that might be attracting certain patients to your services or educating to them as well, that kind of thing. And now you can see maybe a little bit of a, you kind of looked at the other table, but this one has a little bit more of a difference in terms of maybe what's more receptive of some audiences over the others. So you can see here, for instance, the online reviews. More and more as organizations, we really need to be thinking about that, especially as we kind of looked at that growth that we're having in terms of baby boomers retiring and the population increasing among Gen X and millennials, and they're looking up and they want to know what the reviews are, what the experiences have been, and that sometimes is a struggle with organizations because again, maybe having perceptions of, well, some providers might think, well, that isn't something that I need to do. I've never had to do that. I just provide the service that I provide, and that should speak for itself. But again, as we kind of understand how different people think, how they process information, how they make decisions, and how that changes in different generations, then we can see how that would impact our communication. Ease of experience, again, very important. As an example, though, when we look at, things that are more traditional marketing, like targeted mailers and things like that, although they are making a little bit of an impact, a rebound in the more, in the generational and millennial market, you can see that generally they're not responding to those types of things. So anyway, you get the idea. Again, this is kind of meant more of a generalization. There's data to back this up, and we've sourced some of this at the back. This is certainly based on our experience, but this is peer-reviewed kind of information that comes to these conclusions as well. So certainly, as we look at, we're looking at existing patients, different ways that we're communicating even on things like Medicare wellness exams and things like that, and that might be different depending on again, different cultural backgrounds as well. But certainly we're focused more on telemedicine as well. And so that kind of fits into the convenience aspect that we've been talking about. And I believe later in our webinar series, we're actually going to cover this in a little bit more detail in terms of some different ways to communicate telehealth to different audiences. Now, convenience is certainly a large aspect, in particularly among Gen X and millennials, as we've talked about. So those things kind of can get translated in a number of different ways, whether or not it's same-day appointments or walk-in care, extended hours. But again, just being mindful of that one message doesn't necessarily fit all generations as well. Kind of remember when I was kind of talking before and I went through that background in terms of, you know, that there are certain audiences that are maybe looking for more of a personalized experience. So this is an example here of maybe there's where we're providing some kind of more of an interaction for people to maybe answer questions, ask questions of their providers, those types of things as well, that there are ways that we can do that. Maybe especially in the advent now of more things being virtual, that we can even have some sessions where there's some interaction with providers and things like that. So just being mindful that there are different ways, again, in which we process information. So then, just to kind of wrap this up a little, so we have time for some questions as we look at potential patients. Again, some of those same similarities, but we can see here again, you know, the differences in digital acceptance and things like that, print publications and broadcast advertising, more of a traditional audience. So, and again, you know, looking at convenience again for the Gen X, this is an idea that organization that we work with as well has something called a Save My Place, where you can actually reserve your urgent care sort of online ahead of time. You know, just being mindful of those different approaches, again, keeping in mind how different people want to receive information, how they process that information, to realize that it's not a one size fits all. You know, again, now I think we're being more accustomed to using video. So just to really remember that, and that isn't something that has to be expensive in any way. A lot of things that we can do on our own to really share those personal experiences and to demonstrate convenience. And then just overall, you know, again, you know, looking at being sensitive to, as we've defined, you know, our different generational backgrounds. Are certainly, you know, one way that we demonstrate cultural differences, but also just looking at more traditional differences and diversity, and realizing that we maybe do need to be more sensitive to different populations, and that means that we might need to adapt our communications accordingly. So I want to make sure we have, because we have some time for some questions here at the end. So real quickly, I'm going to ask this follow-up survey, and then we'll open it up for questions. So same question that we asked before, which is, how confident are you now in recognizing the various cultural and generational differences in order to better communicate while building trust and understanding? Kim, are you able to put the survey back up?
Yeah, just 1 second here.
Okay.
I'm having some
Okay.
difficulties here.
No problem. There we go.
Well, let me close it out and
It's up now. It's up now.
Oh, you got it.
Yep. So if everyone could just take a real quick minute here and answer that would be great. And then we'll open it up for some questions.
And you can unmute yourself to ask a question of our speakers, or you can put a question directly into the chat box. I had a question about kind of going back to some of that culture and healthcare and how to communicate.
Mm-hmm.
What is the first step to start addressing that? Is it looking at the data to see what our community really looks like, and then trying to create different communication methods of communicating with those folks?
Yes. So you definitely want to identify what the makeup of your community is, because you can go in and have all these great grandiose ideas, but if it's not meeting the needs of your community, then it's kind of null and void. So yes, it's important to know the makeup of your community. And then two, I would also say building that relationship with the community. And so, you know, it may even be having the community events, or, you know, sharing out different information about the community, so on and so forth. But it's truly understanding who you are serving and then understanding what it will take in order to serve your particular community.
Yep, absolutely. I would just add to that oftentimes some of that may come out from your community health needs assessment as well. So just being very cognizant of that. I think sometimes what I have found is that we do those needs assessments because we're required to, and sometimes I feel like as organizations we don't really always go back and really study those and see how we can. I mean, we do, but we do it at the beginning, but just really being aware of different backgrounds. Also wanted to share that Dr. Farrell, looks like I think we have some positive movement in people's competence regarding.
Yes, we do, that's
right.
a plus.
Good,
and again, it's a journey. Today is
Yeah.
not the end all be all, fix
Right.
all of the cultural competency, and it is a starting point. And know that we're all at different levels within our journey. And so it's definitely good to see that the marker has moved.
And I know someone did ask in the chat box here, yes, the slides will definitely be shared after the presentation as well, so absolutely. But other questions. Well, actually, I'm sorry, let me just do the quick summary here. I forgot. So what we've hoped that you've learned about today, again, is learning the needs and the different ways to educate yourself about the local community. We didn't hit on this a lot, but where possible, empower local leaders to speak for you. And I think we focused on how to personalize and customize that message. So, and these are some of the sources as well, and I can give you more specific references if you're interested in seeing some of that the background. And before we finish we have some time for other questions, but then just to remind you that we do have a session next week, which is on building relationships and loyalty through digital marketing, and that's going to be led by Erin Minsart, our VP of Strategic Services at Legato. It's going to be a good one. I think you guys are going to really like it. So, but anyway, let's kind of continue the dialogue a little bit. But as you do have questions, later as well, this is our contact information. So if you want to follow up with any of us, are happy to discuss with you. So.
Absolutely.
Yeah. So I guess I would just kind of ask, just in general, have people experienced, challenges with, or what kind of experiences have challenges have different people had in terms of, being cognizant of different cultural backgrounds? How has that potentially impacted your position? Have you had any challenges that you've had to run into, or just how does maybe the changing of society in some way, how has that impacted your particular position?
And I would even say on the flip side, if there are some success stories and how you have,
absolutely,
we would love to hear that too.
Absolutely.
Well, this is Geneva Bryant with Community Champion for Pembina Memorial Health Systems. And I've lived in this community all my life. And so that gives me an advantage. People knew me, they knew my husband. He was a local general practitioner. So, that all was an advantage for me. But where I run into is not so much with patients and everything. It's with the generation that wants to do everything texting. Sometimes I just want you to call me and talk to me. My nephew sent me a text that said, "Are you going to be at home this weekend? I may be by." Well, I need just a wee bit more information than that, And so, I mean, he's coming from Nashville. He has 3 children, his wife. I need just a bit more information. So, and that's what I run into is my, you know, I know they're busy and everything. And I ran into that when I was having my, sending out my needs assessment survey. And I found that my older people were more than glad to do it, but my real busy young adults, you know, they are real busy. So anyway, they need to also be mindful of us, as we do need to be mindful of them, but they need this.
She muted herself.
Yep, absolutely, absolutely. There's a question on the chat that I can address briefly here. But if anyone would, whoever answered this would like to contact me directly, too happy to do that. But the question in the chat box is thoughts for interacting with millennials. I'm a baby boomer. When opening the discussion of issues, millennials shut down and refuses to interact. You know, I guess one of the things that I have found is that it's kind of looking at what motivates people, and you know, it's you know, again, I know we're stereotyping some, but generally speaking, when we look at millennials, they want to be consulted and they want to be part of a decision-making process. They don't want to be told necessarily what to do. So I think sometimes what happens is that if you have different people of different generations, where you have an environment where the boss said this, so I do this, okay, and that's sort of our expectation, and then so we may, you know, portray that in our communication, and that tends to backfire. It's a delicate one because, you know, ultimately there's a reason why there's a leader, and sometimes there's decisions that need to be made that not everything is made on a consensus basis, you know, or shouldn't be. I guess that's what I'm also saying. So that's my short answer to that, and I'd happy to be, you know, talk more about that with anyone. And I don't know, Dr. Farrell, if you have anything you would add to that. So
I agree with you 110%. And
okay.
so again, you have to figure out what motivates your employees in order to know, you know, what makes them go. Because what makes one person, you know, thrive and be productive may not make that next person do the same. And so you really have to figure out how you can meet them halfway. And I would even say from earlier, Miss Geneva, in the example about her nephew, having that dialogue, you know, not saying, I want you to communicate this way because that's how I communicate, but
right.
really coming from a, you know, empathetic or compassionate place of, all right, so can you tell me more and what you're wanting? And, you know, when you start to really build up that dialogue and relationship and communication, then that's when you start to see change. But if you don't do anything about it, then things are going to continue to be the same. So that's pretty much what I would say on that.
Excellent.
I did text him back and say, would love to have you, need a little more info regarding meals and bedding. So
yeah.
And did you get it?
Yeah, well, I did text him back and he hasn't responded yet. So I'm just going to have you know, my house ready. And then as far as food, he better let me know. Because I'm single and
thanks
I
for
don't
sharing.
cook much.
Yeah,
thanks for sharing.
My regular communication with my adult children is Snapchat. So yes, so
I don't even know what Snapchat is, so I'm still on texting. You know, in this rural area, we don't have the best internet service.
Sure.
And so we try to keep it simple.
We just got a suggestion in the chat box. I used to leave messages for patients when I make follow-up calls, and I get more calls back from patients when I started sending text messages instead of only using voice messages.
They probably, it's quicker to look at a text message and glance at it than it is to listen, I guess, is what I would say to that. Maybe they don't listen to their messages, whereas they're everywhere I look, everybody's got a cell phone in their hand, so I know they're checking their messages.
Well, I just want to say thank
thankful for
you. Oh, go ahead, Mia.
No, go ahead, Kim.
I was just going to wrap us up. So if there's anything else you wanted to say, go for it. Otherwise, I just wanted to thank everyone for being on today, and especially our guest speaker, Dr. Mia Farrell. And Mike, as always, this was a fantastic presentation, and I look forward to next week.
Great. Thank you, everyone.
Thank you.
Okay.
Bye-bye.
Take care.
Thank y'all very much.
You're very welcome.